I'm actually filling in for a colleague who couldn't make it up this week. She had some health issues, so excuse me if I'm a little bit of a novice at this. Annie had this all prepared and she would have loved to have been with you, because this is a project that Freedom have been running for over 12 months, and we're extremely passionate about helping older Australians navigate the aged care maze. What Roslyn was talking about before, person-centred care in practice, I think is actually what we strive for with what we can offer to the aged in our hubs that we offer. We run a sessions in GP practices. We've got 8 of them running at the moment, and each industry team member has one and sets it up within a practice. It allows us the opportunity to work with the aged patient in this case, because they're coming through the practice, or the aged person or their family at whatever part of the process they're up to. The issue of ageing is such a maze. GPs start it, they touch on it. Practice nurses haven't got the time. What we offer for the GP surgery is the referral process to come and see extremely experienced nurses in place that can help them, guide them through the process. We can't answer every question at the time, but we have the opportunity to follow up. We don't have restrictions to our time. We've got the hour to give to somebody if they want to return and they need further follow-up, then we can do that for them as well. Because we've only got 8 hubs that are running at the moment, we also run a phone service. So within our timetable that we've got set up, if somebody's in an area that can't be reached, they don't have mobility, they haven't got a car, they can set up a time and we'll call them or they'll call us. Sometimes that takes a couple of times to happen, but it's a service that they really, really value. I don't think anybody else actually offers this sort of thing at the moment, so we're feeling our way. We're letting the service evolve. We are fully supported with, we have all the government information there for them. We have within our local communities, community resources, aged care home information. We have whatever they may need. We don't make recommendations, but we can inform them and advise them of their options going forward. Sorry. Oh, I forgot to use my slides, sorry. Okay. This is something practice nurses will all be aware of. Our ageing population is booming. Okay, an increased demand for aged care services is why we began it, but it was also the opportunity to inform our aged. Once we get to 65 and care needs start to come up, there are so many options. And I have been in the industry for maybe 22 years, and possibly most weeks I learn about a new service or a new option or a new availability to somebody in that circuit. So if we can at least provide a base that's got, you know, a huge variety of information, we're gathering it constantly. Within our hubs, we also meet local providers of services in the area. It might be new community-based systems, it might be what's operating for the dementia, it might be, you know, a new podiatry. So we're able to keep any of our aged or families that come to see us really well informed. We also work really well with the GPs. They love the fact that they can supply or provide to their patients a service that's got time to listen. We can provide an hour's time, we can have a cup of tea, we can actually listen to where they're at in their ageing process and help them to work through it. And honestly, sometimes it's just being heard and understood and a little bit of empathy and a little bit of understanding. And we do have the time to treat them, you know, in a person-centred manner. And I mean, we're really lucky. I've never worked in a job to actually have the opportunity to have the time that we can actually give back to the community. So as an employee, it's pretty fantastic too. And as a nurse, it's amazing. We've spent our whole life being so busy, being pulled from pillar to post, that this is a really good opportunity for us to do a proper job, see something through, have the time to follow it up. Okay, we also developed it to make sure they understood the options. The options are growing every year. There's different alternatives. Everybody's branding their products slightly differently, and people need to be aware of what they can do. Navigating the system, just getting onto. I had a family come last week, and he was just coming in for his dad. The My Aged Care system is so good, but you do need a few skills to get there. He needed the time. We could sit down, we could look at the program with him, work out where his dad sat, how we refer him if they want to, and work with it. We have all the government information with us so that we can go through the brochures and the how to do it systems and spend that time. It's once you get into it, it's easier, but for the novice and for the early adopter, it's really hard. Okay, we do. They're at the centre. The patient that we see, it's often a family member, and it's often a carer that's providing care for somebody at home. So, I mean, last week I had this poor man come in, and his wife was Greek, and she was suffering from early dementia, and they had a package in place, and they were struggling at home because she constantly felt challenged by the carers that came in. They didn't understand her. She'd reverted back to speaking her native language, and it was getting harder and harder. So he didn't know what he could do and what options he had. So we had a look at his list from his provider and the staff that he felt that were really good. And a lot of providers now subcontract out to other providers to be able to maintain their commitments. So within the list, he picked one that he really loved, and she was a little Greek girl that came, and she actually, it turned out, came from a Greek provider that was based over in Brunswick. So we could look at that and discuss the options. I said, we can ring the provider, they can come out, let them know what they can provide for you, and possibly support your wife with Greek carers rather than who she's struggling with at the moment. So he was happy. He had a plan, he had something to do, he could actually do something about it. So we were moving on. Sorry guys. Have I got stuck? Okay, this was when it first began, which is in August, September 2017. It's been growing since then, and by June this year, it's committed to the program will be reviewed and looked at how it can be used going forward. Freedom Aged Care have supported it in that they fund and allow us the time to be in the communities. Everything that we use is non-branded. It's presented just as an aged care hub. It's not presented as a freedom model, so that it's across the board. It's not limited. Okay, so it wasn't initially a 12-week program that began in August, September, but it's now going through until the end of this financial year and will be reviewed then. Okay, we've started in general practices because we see that that's where the most support is possibly needed. We rent the offices I've talked about. Up to date, non-biased. Sorry, guys. Okay, we are definitely what we'd see as a collaborative model. The GP practice that I work at in Melbourne couldn't be more grateful for having this sort of resource that they can send their patients down to and make sure that they're getting it. The model for them is incredibly hard to navigate. The practice nurse is not always available. We'd really like to think that we're there also to support the practice nurse, and that's where often a lot of our referrals come to, as well as with the GP. Sorry. Okay. The review to date is that the patients that we see, it's really positive. They leave with a smile on their face. They know that they can revisit us. The practices are feeling really empowered that they've got so much more to offer their clients and their patients when they come. It's been an amazing experience to actually do this. Okay, and our referrals are continuing to build. We've brought along at the conference today and yesterday, talking to all your practice nurses, we've provided lots of you with information about what we do, and we've brought some in this morning if you want to take the brochures away. We have cards that you can actually give to your clients or patients and a contact number on the back so that they can set up, here we go. These are the cards that we've developed to actually give out to your patients so that there's a number on the back they can call. If they can't visit, they can definitely set up a phone appointment. We're also using them with discharge planners and social workers at hospitals. They're finding it's brilliant, particularly people who are just beginning the journey and have no idea, where to begin. Okay, thank you, girls. Boys.